Setback or progress, what it means when a tracheostomy patient switches back to humidified oxygen. My name is Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, where we provide home BiPAP and CPAP ventilation without tracheostomy, tracheostomy care without ventilation, home TPN, home IV potassium, home IV magnesium, home IV antibiotic infusions, central line, PICC line, Hickman's line, as well as port management at home, cough assist management at home, ventilation weaning at home, nasogastric and nasotracheostomy tube management at home, PICC and pitch tube management at home, as well as palliative care at home. So why families can worry when tracheostomy setup changes. And today I have a question from one client who wants to take their mum home from ICU with intensive care at home after months in ICU. So here's the question from the client who says, "Hi, Patrik. I spoke to the nursing team who said that my mum was struggling with the HME filter on the tracheostomy, but that her oxygen levels were fine, yet she was working a little too hard to use it. So they switched her back to the humidity collar and the large tracheostomy. I see this as a setback to her coming home and eventually weaning off the tracheostomy. What's your opinion?" So let's break this down and look at what's really going on here. So understanding that HME filter, what an HME filter is and why it can be difficult. The HME filter stands for heat and moisture exchanger, also known as a Swedish nose, helps retain humidity and warmth in the airway. It's usually put at the top of a tracheostomy when someone is not ventilated. However, in tracheostomy patients, especially those still regaining strength, it can create extra resistance. That means your mum has to work harder to breathe through it, even if her oxygen levels look okay. It's also a case of if your mum produces a lot of secretions and the nurses in hospitals are not picking up on that, she may cough phlegm into the HME filter, and that will simply block the filter, and it makes it very difficult for your mum to breathe. So really, these are the intricacies of tracheostomy care in intensive care that people would only know if they've worked in the environment for decades like I have. So while switching back to humidified oxygen is not a setback at all, moving from an HME back to a humidified oxygen collar is not at all a regression. It's a stabilizing strategy also. An HME filter should only be used temporarily, really. Whilst the HME filter is also providing humidification, it's nowhere near as good as being on the humidifier as such or getting a nebulizer. The team likely wants to reduce her work of breathing to prevent fatigue and keep her comfortable. Once her lungs and muscles get stronger, she can and should retry the HME and continue progressing towards decannulation or the removal of the tracheostomy. So what this means for coming home is, the good news is this change will not stop your mum from coming home. Any of our clients at intensive care at home are coming home with a tracheostomy with or without ventilation and have been safely cared for by our 24/7 critical care nurses, CCRNs, and bringing the intensive care into the home. The key really isn't whether your mum needs humidification or an HME. The key is ensuring that she has continuous ICU level nursing support at home. That's exactly what we provide, as you know, so that we can manage both the HME as well as the humidification. It's going to be an alternation between both. I can assure you of that. And hopefully she can increase the time that she's on the HME. But like I said, on a day, for example, where she has a lot of phlegm coming up, a lot of secretions, it's much more difficult on a day like that to keep the HME on as opposed to going back on the trach collar. Like I always say, the biggest challenge for families in intensive care is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. This is not a setback at all. I can only stress that. Also, let's have a look at what's happening at home with evidence-based safety 24/7 CCRN care at home, according to the mechanical home ventilation guidelines that you can find on our website at intensivecareathome.com. And I have linked towards those guidelines in the written version of this blog. Any patient with a tracheostomy plus minus a ventilator must have 24-hour ICU nursing at home for safety. Patients have died if that level of safety was not provided. That means your mom needs one-to-one nursing care by a CCRN trained nurse capable of managing airway, suctioning, responding to emergencies, changing a tracheostomy, changing the inner cannula if needed, and preventing hospital and ICU readmissions. It's not optional. It's evidence-based best practice for patient safety and quality of life. Because here at Intensive Care at Home, we bring the intensive care environment into your home with full tracheostomy, ventilator, and medical management by ICU nurses 24/7. Families often tell us they see dramatic improvements in their loved one's comfort, communication, and emotional well-being once they leave ICU. They also see a lot of improvement in their own responsiveness, in their own quality of life, in their own mental health, because they can finally leave what can be a traumatizing intensive care environment. Your mom's situation fits perfectly into what we do every day at intensivecareathome.com, helping patients come home safely, even if they still need ICU level care, humidified oxygen, tracheostomy care, slow weaning, alternating between HME, trach collar, airway, nebulizer. It's bread and butter for us. So don't see this as a setback whatsoever. See it as part of your mom's stabilization process, part of your mom's progress in general. Now that she's medically stable, she can absolutely transition home safely with intensive care at home with 24-hour nursing care. Now, with intensive care at home, we are currently sending our ICU and critical care nurses into the home 24 hours a day. We are providing the following: home care services for ventilated adults and children with tracheostomies with critical care nurses 24 hours a day. A genuine alternative to a long-term stay in intensive care or long-term acute care, tracheostomy care for clients without ventilation, home care services for patients on non-invasive ventilation such as home BiPAP, home CPAP, home TPN, which is also known as IV nutrition, home IV potassium and home IV magnesium infusions, IV fluids, and IV antibiotics. We are providing central line management, peak line management, Hickman's line management, as well as port management at home. We're providing nasogastric tube and PEG tube management at home, the use of cough assist machines for our clients for airway clearance at home, palliative care services at home, as well as ventilator weaning at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going to an emergency department. That also means we're in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs between $5,000 to $6,000 per bed day. Our service costs between $2,500 to $3,000 per bed day, and we're freeing up the most sought after bed in the hospital, which is the ICU bed. Most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. Of course, quality of life is much improved surrounded by families and by a team of dedicated intensive care nurses in the home care setting instead of in an intensive care unit. With intensive care at home, we are currently operating all around Australia in all major capital cities, as well as in all regional and rural areas. We work with NDIS clients all around Australia, TAC and WorkSafe in Victoria, Department of Veteran Affairs all around Australia. Our clients and we as a service provider have also received funding through public hospitals, private health funds, as well as departments of health. We are having policies and procedures for intensive care at home nursing, and we've built all the intellectual property for intensive care at home since 2012. No other provider in Australia has created more intellectual property when it comes to intensive care at home nursing than we have. This puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. So if you're at home already, and if you're watching this, or you're stuck in an ICU long term, or if you're going to hospital and ED all the time, and you realize that you don't have the right level of support at home, or if you are stuck in an ICU, I'll give you a real-world example today how we can help you. One of our first clients when we first got started in 2012 was a client who was at home initially on a ventilator with a tracheostomy with a support worker model 24/7. Of course, support workers are not equipped to look after a client at home on a ventilator with a tracheostomy. That is dangerous and it's simply negligent. Having support workers looking after a client at home on a ventilator with a tracheostomy is like flying the airplane with the cabin crew instead of the pilot, because anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies 24/7, or even at high risk of dying if they don't have a team of dedicated critical care nurses looking after them 24/7 at home. This is actually evidence-based and is documented in our mechanical home ventilation guidelines that you can find on our website at intensivecarehome.com. Think about it. In an intensive care unit in a hospital, you wouldn't have support workers looking after your critically ill loved one or after any critically ill patient on a ventilator with a tracheostomy. So why would anyone in their right mind do that in a home care environment in the community? So this client at the time found out about us eventually, and the ICU that he was basically living in also knew about us and eventually reached out to us. And we were proving our concept with this client very fast. When we worked with this particular client, we sent him critical care nurses 24 hours a day, and he never ever went back into ICU ever again, as long as we were working with this client. We can do the same for you if you're not safe at home and help you with keeping you at home predictably. Otherwise, we would not be in business. Again, the same is applicable for those stuck in an ICU, similar to this case study that I've just given you. Or if you're going back to ED all the time, please reach out to us. We can help you with taking you through the right steps, including how to get funding with different funding bodies. This is also why we are providing NDIS support coordination. We have a team of NDIS support coordinators, and they have a wealth of knowledge. I've done an interview with Amanda Richards, one of our NDIS support coordinators, and I'll put a link to an interview with Amanda in the written version of this blog. We're also providing TAC case management and WorkSafe case management in Victoria with Lucy McCodder. If you're an NDIS support coordinator or a case manager from another organization watching this and you're looking for nursing care for your participants, please reach out to us as well. If you need more evidence for nursing care, we are also writing NDIS nursing assessments with legal nurse, critical care consulting nurses. If you are a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic, and high-performing team of critical care nurses in the community, we're employing hundreds of years of critical care nursing experience combined. You can join this high-performing team if you are a critical care nurse. If you are looking for a career change as a critical care nurse, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, in Warragul, in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I do have a disclaimer though, because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients also do want the same staff coming over and over again because they are so vulnerable and so special. That's why we need regular staff. So if you're looking for agency work where you can come and go, this will not be the right fit for you. We are looking for consistency and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts and you're really keen on building solid relationships with us and with our clients. If you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in your ICU and in your ED for your long-term patients, or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. Even if you do pay for it, It is so much more cost effective than what you're paying for in ICU and ED, and you get the same level of care. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, or for home TPN, please reach out to us as well. We can help you eliminate your bed blocks very fast. If you're in the US and in the UK, and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and with hiring nurses privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website, or simply send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next or what questions and insights you have from this video. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.